coming to the ED is never a fun experience, so we know that, and we try to make it as comfortable for the patients and the families as well, offering them food or drink or chairs or warm blankets, whatever they may need.
We don't usually have a wait. We do immediate bedding, so if we have an open bed, the patients come right back to a room and we try to see them right away.
We're kind of like a family here, so we give a lot of personal attention to the patients, and I think that's reflected in our very high patient satisfaction scores.
We don't have any restrictions on the visitors that are in our department. If you want to be with your family member, we want you to be at their bedside, and we want to take care of the family as much as the patient.
Well, as emergency room physicians, we have a very small, limited amount of time to gain a personal feeling for that patient. So our empathy and our ability to communicate with patients are very, very important. So we pursue getting to know the client and patient's family in a very rapid manner and in a very empathetic and very comforting fashion, whereby we sit at the bedside letting them know that we're there for them.
We're one of the few hospitals in the area that has the expertise of Washington University, BJC, as well as private physicians all working together to take excellent care of you and your family.
We can see any emergency. You know, we have an 8-bed emergency department. We do have ambulances that come here. We have a lot of patients that live in our neighborhood that come here. At Barnes-Jewish West County Hospital, our Washington University emergency medicine physicians are prepared for expert medical emergency management. And if something is highly complex, our relationship with Barnes-Jewish Hospital gives our patients immediate access to rapid transfers and transitions of care.
We have the equivalent, if not better, technology as the surrounding hospitals for the specialties that we have here. We're a Barnes facility, so certainly we're up to date with all the latest technologies and current practices in medicine. If the patients are admitted, if the hospital is very easily accessible, it's very difficult to get lost versus some of the surrounding hospitals. They can be pretty challenging to get parking, get your patients in, and getting to the floor. So I think it's less daunting.
Our philosophy for taking care of patients is just to provide them the emergency care that they need with compassion.
We do get letters and calls from patients and their families that have good experiences in our emergency department, and I think that reflects in the quality of care that they've received.
It's emergency care right in your backyard.
Rest assured that our staff is going to give the best care and the best compassion of any smaller ED in the St. Louis area.